So this lecture, this series of recordings is about uh, infants who have some sort of complication, the at-risk newborn or the ill newborn. So you've learned about what the newborn transition is supposed to look like. It's going to be very important for you to understand that information in order to understand what are the things that can go wrong. You've also learned about care of a healthy newborn. So now we're going to talk about sick newborns. The first thing we'll talk about is infections in the neonate. A newborn can have a serious infection that's in a localized area like pneumonia, bacterial meningitis, gastroenteritis. Any infection in a newborn is serious because their immune system has limited ability to fight that infection. Those infections can be congenital. They can be born with the infection because of exposure in utero, or they can be acquired either in the hospital or in the community. I want to talk about some known or some fairly common congenital infections. There is a chart on page 646 that will help you kind of organize this information. All of these are infections that can cause fetal death, fetal anomalies, or can cause illness in the neonate. So these are infections that if the mother has them, they can cause complications for the fetus or the newborn. The first set of infections I want to talk about is called TORCH. There's an acronym TORCH for these infections. The TORCH stands for toxoplasmosis, other, rubella, CMV, and herpes simplex. So exposure to any of these in utero can cause complications. The first is toxoplasmosis. Toxoplasmosis is primarily passed in cat litter, and this is why we recommend pregnant women have someone else change the cat litter. Most people who have cats have had it at some point. It's a mild illness. They may not even be aware they're ill. But if someone has an active plasmosis infection during pregnancy, it can cause serious anomalies if it's early in pregnancy, and it can cause intrauterine fetal death. So toxoplasmosis is one of them. Other covers about three, Hep B, parvovirus, and HIV. Okay, hepatitis B is a bloodborne illness. It can be transmitted via the placenta. In a newborn, it may be asymptomatic. The mother may be asymptomatic. This is why we test for Hep B in pregnancy. An infant who is infected with Hep B has a 90% chance of developing chronic hepatitis B. So what do we do to try to prevent and manage this? All infants should receive the first dose of vaccine at birth. Patients who have an out-of-hospital birth may actually have that done at the first pediatric visit, but all infants receive that first dose of Hep B vaccine at birth. If the mother is Hep B positive, the baby needs to have the vaccine within 12 hours, but they also need to receive Hep B immune globulin. And they need to receive the entire 3 series vaccine. So if the mother is Hep B positive, we still do the vaccine for the baby so that they can build their own immunity, but we also give immune globulin so that they can fight that infection immediately. Parvovirus, human parvovirus, you may be familiar with parvo for puppies, but human parvovirus is fifth disease. It's a pretty mild childhood illness. Again, people may not be aware that they have it. When someone does have it, they may have like a slapped cheek rash that comes and goes. Frequently when kids have fifth disease, they may or may not have a little bit of a fever and congestion, but what's mostly noticed is when they're running around playing, this lacy rash like they've been slapped shows up on their cheeks, and then it fades at times. So it kind of comes and goes. So because of that, frequently it is also not diagnosed. In pregnancy, if a pregnant woman has fifth disease, has active human parvovirus. It can cause severe fetal anemia. Fetal hydrops is when the fetus develops congestive heart failure as a result of severe anemia and intrauterine fetal death. And so we want to avoid that pregnant person being exposed to fifth disease. HIV is transmitted by, it can be transmitted by placenta. It can also be transmitted by breastfeeding. If the mother is HIV positive and is on a good medication regimen, that has really drastically decreases placental transmission. So it's very important to identify as women who are pregnant who have HIV because meds can prevent transmission to the fetus. Delivery is usually done by C-section to avoid exposure to the mother's blood. Breastfeeding is contraindicated. If you look at the World Health Organization website, it's going to say that in some locations, if the water supply is so unsafe that the baby's likely to die of a diarrheal illness if they're not breastfed, then they would recommend breastfeeding, but we would also want that patient to be on meds. The problem is that the locations where that happens, meds are not always as available. But as far as practice in the US and a developed place is concerned, breastfeeding is considered contraindicated in mothers with HIV. The infant is going to test positive, usually for up to 6 months because of maternal antibodies. So we cannot determine whether the infant has HIV or not until they've had time to clear those maternal antibodies. The R in TORCH stands for rubella. Rubella, again, is a relatively mild childhood illness. Most of us don't get rubella anymore because we vaccinate. If someone is pregnant and gets rubella, it used to be called German measles. It's similar to measles in appearance, but it's a much less severe illness. So if someone who is pregnant gets it, then depending on the stage of pregnancy, it can cause severe congenital anomalies, especially in the central nervous system, heart, vision, and hearing. Later in pregnancy, it can cause fetal death. The emphasis on this is vaccinating children. This is one of the reasons, this is one of the things that's in the MMR, and this is one of the reasons we vaccinate. Rubella is not usually a severe illness in the person who's affected. We vaccinate for rubella to prevent severe anomalies for pregnant people who would contract it. Rubella is also a live vaccine. So if someone does not have rubella immunity, and that's one of the things that we test, we do draw blood for rubella antibodies. If they don't have rubella immunity, they cannot be vaccinated during pregnancy. They should be vaccinated postpartum if they're not immune, and they need to avoid getting pregnant for 28 days. CMV is the C in TORCH, cytomegalovirus. This is a virus that can cause severe neurologic and systemic effects in the fetus. Herpes simplex. So herpes simplex is the virus responsible for both cold sores and for genital herpes. And at one time, they were mostly separate strains, but they've been kind of mixed around. What you need to know is that any herpes simplex virus can cause lesions, can enter the body and cause lesions on mucous membrane or broken skin. If the mother has an active herpes simplex infection at the time of delivery, the baby can contract that in delivery, but it may also be transmitted in utero. They're not sure. If there's if there are active lesions at birth, then a C-section is recommended. Herpes simplex can cause a local infection. So the baby could, for example, get a cold sore or a herpes lesion at the site of the fetal monitor if they have internal fetal monitoring. It can cause a central nervous system infection. It can get into the brain, and that causes permanent permanent damage, or it can cause sepsis, and herpes sepsis is very difficult to treat. Herpes sepsis and central nervous system infection have high mortality. A baby who is suspected to have herpes lesions needs to be handled with contact precautions, because that can be passed by contact, again, to any mucous membrane or non-intact skin. It also can stay on it can stay on an object that is wet, like wet washcloth can pass it from one person or one location to another. Herpes can also be transmitted from cold sores in the neonatal period. This is one of the reasons that we want to caution people against letting everyone kiss the baby. There have been babies who died of herpes sepsis because someone with a cold sore kissed them. So herpes simplex can be really, really serious for infants. Okay, so we talked about the torch infections. We also look at chlamydia. If the mother has chlamydia at the time of delivery, it can cause conjunctivitis, which can lead to blindness. The blindness is more common with gonorrhea, but if they have chlamydia, remember, chlamydia and gonorrhea like to go together. But chlamydia can cause conjunctivitis. It can also cause a pneumonia. This is the reason we do eye prophylaxis for all newborns. If we have known exposure, that baby is probably going to get some additional follow-up antibiotics and follow-up monitoring. Gonorrhea. If the infant contracts gonorrhea during delivery, if they get conjunctivitis, it can actually infect the eye, the optic nerve, and cause blindness. It can cause arthritis. It can cause septicemia. It can cause meningitis. So gonorrhea is a much more virulent infection for the newborn. Again, we use eye prophylaxis. If we know that baby was exposed, they're going to get more treatment. And if a baby has gonorrhea or chlamydia at birth, they need to be tested for other STIs, because remember, STIs are friends and they like to hang out together. Congenital syphilis. If someone has syphilis in pregnancy, it can cause stillbirth, prematurity, high drops. Again, remember, high drops is like congestive heart failure in the fetus. Syphilis may be asymptomatic for the person who's pregnant at that time, because remember the time periods when the different phases occur. The infant may be asymptomatic at birth, depending on where they are in that infection process. A newborn or a child with syphilis may have a copper-colored rash, and they may have hair and nail loss. They may have the snuffles, which is kind of just a sniffly, runny nose. They may be anemic, and then they may have other signs of syphilis. Syphilis is treated with penicillin, but if there has been damage to developing structures, that damage can't be fixed. We can fix the infection, but not the damage. And then we monitor for complications. Okay, and the next section is going to be about neonatal sepsis.